day. This is the Professor, CBMD PhD, and today is Saturday, August 26, 2023. It is 5:07 and 19 seconds, AM Eastern Standard Time, and today's research, ChatGPT and cancer. So let's jump to it here. As ChatGPT shows limited ability to recommend guidelines, based cancer treatments, correct and incorrect recommendations intermingled in 1/3 of the chatbot's responses, making errors more difficult to detect. Date August 24, 2023. Source: Brigham and Women's Hospital. As for many patients, the internet serves as a powerful tool for self-education on medical topics. With ChatGPT now at patients' fingertips, researchers assess how consistently the artificial intelligence chatbot provides recommendations for cancer treatment and align with National Comprehensive Cancer Network guidelines. As patients should feel empowered to educate themselves about their medical conditions, but they should always discuss with a clinician, and resources on the internet should not be consulted in isolation. As ChatGPT responses can sound a lot like a human and can be quite convincing, but when it comes to clinical decision making, there are so many subtleties for every patient's unique situation. A right answer can be very nuanced and not necessarily something ChatGPT or another large language model can provide. The emergence of artificial intelligence tools in health has been groundbreaking and has the potential to positively reshape the continuum of care. Researchers focused on 3 most common cancers: breast, prostate, and lung cancer, and promoted ChatGPT to provide a treatment approach for each cancer based on the severity of the disease. In total, the researchers included 26 unique diagnosis, descriptions, and used 4 slightly different prompts to ask ChatGPT to provide a treatment approach, generating a total of 104 prompts. Nearly all responses, 98%, included at least one treatment approach that agreed with the National Comprehensive Cancer Network guidelines. However, the researchers found that 34% of these responses also included one or more non-concordant recommendations, which were sometimes difficult to detect and miss otherwise sound guidance. A non-concordant treatment recommendation was defined as one that was only partially correct. For example, for locally advanced breast cancer, a recommendation of surgery alone without mention of another therapy modality. Notably, complete agreement and scoring only occurred in 62% of cases, underscoring both the complexity of the National Comprehensive Cancer Network guidelines themselves and to the extent to which ChatGPT's output can be vague or difficult to interpret. In 12.5% of cases, ChatGPT produced hallucinations or treatment recommendation entirely absent from National Comprehensive Cancer Network guidelines. These included recommendations of novel therapies or curative therapies for non-curative cancers. The researchers emphasized that this form of misinformation can incorrectly set patients' expectations about treatment and potentially impact the clinician-patient relationship. Going forward, the researchers are exploring how well both patients and clinicians can distinguish between medical advice written by a clinician versus a large language model like ChatGPT. They are also prompting ChatGPT with more detailed clinical cases to further evaluate its clinical knowledge. And this is a professor of microbiology, bioinformatics, pathophysiology, and nature of research. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.